Hello, it's Dr. Pat with Little Critters, and Badger is with us today. He's a 7-year-old male ferret, and Badger has some coat changes. As you can see, we have kind of mostly guard hairs on the back. He's lost a lot of undercoat. They're also real stiff and coarse. And we have a little ratty tail where he's lost most of his hairs on his tail. And Badger does have a history of adrenal gland disease. This is very common in ferrets. Ferrets are extremely prone to overactive adrenal glands, and even in spayed and neuter ferrets, these adrenal glands, when they enlarge and become more productive or active, actually produce sexual hormones from the adrenal cortex, and these hormones will cause coat changes. And Badger usually, he's a little busy. Badger usually responds really well to the supralorn implant, also called deslorelin. And this is a hormonal implant. It's about the size of a rice grain, and it gradually releases the suppressing hormone over several months, and these ferrets will fully recoat. Adrenal gland disease is not just a cosmetic problem in ferrets. It often leads to many other problems. And so in females, we can see chronic estrogen release, even in the spayed females, and this can cause bone marrow suppression and can be fatal in females. In males, we can have periprostatic cells that swell up and can cause some urinary problems and inability to urinate. They often will get an itchy syndrome, so you can see many other things associated with adrenal disease. So if you're starting to see coat changes in your ferret, you should get your vet to take a look, test him for adrenal disease, and consider the supralorn implant if needed. Just as an aside, Badger is also an insulinoma ferret. So he has a small tumor in his pancreas, and it releases insulin, which chronically pushes down his blood sugar levels. You'd never know it looking at him today, but if you watch him closely, you'll notice he tremors a little bit or shivers a little bit, and this is because his glucose is often low. We're actually getting some labs on him today. He is on medications, both prednisolone and diazoxide, and has been well controlled on his last blood tests. And last point, do you have a ferret with any white on their face? If you do, you should check the hearing. Many of these ferrets with the blazes and more white markings or gray on the body are deaf. And I've had many owners that never even realize this because ferrets hide it really well. They navigate great, and most ferrets aren't great about coming when they're called, and so owners never notice. But this is a congenital problem in ferrets. There was an actual study done, it was on European ferrets, and it showed that about 7% with the blazes and white marks had one ear that was deaf, and 34% of the ferrets tested were bilaterally deaf or deaf in both ears. And this was a European study. There's some debate that the European ferrets are probably a bit healthier than the American ferrets. So the incidence may be much higher, and certainly in my practice, I very routinely see deafness in the blazed or white ferrets. Does not affect their quality of life. They do great and explore and are just as mischievous as always. And if you have ferrets, you always want to get a pedicure on a routine basis. If you'll notice, Badger has some really long fingernails, so we're getting those trimmed. But the worry is when animals' nails grow longer, they'll often catch their nails in things, especially in carpet, and then they can move suddenly and they can break toes. So we want to make sure we're regularly getting them groomed as far as just getting tootsies done. That's Badger.